Type 2 diabetes is growing at an alarming rate in this country, along with obesity rates. There are 30.3 million people in the U.S. that have diabetes. Many of our prospective patients at medical weight loss centers ask if they can utilize our diet protocol if they are type 2 diabetics. The answer is simple. If you are a type 2 diabetic, you should be on this diet. Why? For the first time ever, the American Diabetes Association has formally voiced its support of low-carbohydrate diets for weight management in type 2 diabetics. Many patients don't realize that type 2 diabetes is actually a blood sugar or glucose problem and an insulin problem. Type 2 diabetics still produce insulin in the pancreas. However, that insulin does not function very well. The resulting sugar or glucose remains in the bloodstream and gets converted to fat. Elevated blood sugar or poor glucose control leads to multiple complications and typically multiple medications. In fact, by the time a patient is diagnosed with type 2 diabetes, half of the cells in the pancreas that make insulin are forever gone. The goal then becomes to preserve the remaining insulin in our bodies to avoid going on injections of insulin for blood sugar control. Some of the problems associated with type 2 diabetes include stroke, eye, heart, and kidney disease, and vascular problems. Arthritis and certain cancers can also develop as a result of poorly controlled diabetes. By joining medical weight loss centers now, you can begin a comprehensive diet, exercise, and behavior modification program to help you lose weight quickly and lower your blood sugars immediately. Our program is the most aggressive, medically supervised weight loss program available. For example, John G. came to us with uncontrolled type 2 diabetes and was taking both pills and insulin to control his blood sugar. John was able to come off his insulin after just 2 weeks on the VLCD. He also quickly came off his oral hypoglycemic medications. He lost 105 pounds, and his blood sugar and insulin levels improved dramatically. On our very low-calorie diet, you will be eating protein 6 times per day and significantly reducing your carbohydrate and fat intake. This protocol will keep your blood sugars low and steady. By the way, preventing highs and lows in blood sugar help control hunger and cravings, which cause many people to quit or fail diets. Lower blood sugar translates to lower blood insulin levels, which translates to increased fat loss. Suppressing excess insulin production is a crucial and often overlooked component of a fat loss program. The role of excess insulin in causing weight gain has been an accepted scientific fact for years. Building on this observation, some scientists have postulated that it is impossible for people to lose significant body fat as long as they have insulin overload. The reason for this is that individuals cannot mobilize fat from storage if insulin is present in the blood. And if an individual is overweight, fasting insulin levels are elevated. 2 out of 3 people with diabetes will die from heart disease or stroke. Diabetics have a 4 times higher risk of dying from heart disease than non-diabetics. Don't become a ticking bomb waiting to explode. Act now to begin improving your health and controlling your risk of heart disease. Patients who follow our VLCD diet protocol can expect to drop their fasting blood sugars by almost 40%. This means we can get many type 2 diabetics off oral hypoglycemic medications while decreasing insulin levels at the same time. This protocol will also lower your cholesterol. Why is this important? Cholesterol is a waxy fat-like substance that accumulates in coronary arteries. Couple this with sticky blood from diabetes and you have a recipe for a major blockage which may lead to a heart attack. In the 70s, Northwestern University conducted a large study with over 17,000 participants in the early to mid-30s. The study included overweight and obese patients in one half and normal weight patients in the other. The overweight and obese patients had no medical problems at the start of the study. At the conclusion of the study in 30 years, overweight and obese patients were 64.7% more likely to die from heart disease than their normal weight counterparts. As this slide demonstrates, most people who complete our VLCD and maintenance programs are able to sustain their weight loss and glucose levels for long periods of time. Imagine how you will feel after losing 40 or 50 pounds. Imagine the relief and stress off your heart, which is a muscle, and the decrease in requirements for insulin from lower blood sugars. You will feel energized, motivated, and healthier after completing our program. Whether you are overweight, have diabetes, hypertension, elevated cholesterol, heart disease, or the metabolic syndrome, you will benefit from eating a low glycemic diet. Low glycemic carbohydrates prevent sharp increases in glucose and insulin in the bloodstream, so blood sugar and insulin levels remain lower with less peaks and troughs. Isn't it better to take aggressive control of your type 2 diabetes now, rather than later when it may be too late? Remember, without proper treatment and blood sugar control, diabetes can lead to multiple medical problems that can become disabling or even fatal. Join medical weight loss centers now and control your diabetes for good by adapting a healthy lifestyle change.